Huh?
What are you upset about right now?
Because I come, they want to treat them patients out in the waiting room first, then me. I came in by paramedics. Okay, if y'all want to treat them out in the waiting room first.
I don't know why you feel that though. There's a lot of patients here right now that they're seeing a lot of people.
Right, but the first guy came in, he said that she's seeing patients that's coming in from the waiting room.
Do you know what they're here for though? Because if some people are here for chest pain or something that...
Okay, but if they I ain't trying to worry about what they're here for. If it's serious, they came in by EMT.
Well, not always. Not always. That doesn't always happen. I mean, people do come here with chest pain and stuff in cars as well, and sometimes they're bleeding out and they come in cars, and they have strokes and they come in cars, and you know we have to see you according to you know who's the worst at the moment. You know, I feel like we're being fair, but I'm sorry that you don't feel that. You know, I didn't look and see exactly who's ahead of you. I can and see to assure you, because we wouldn't cheat. I promise you that.
This is getting ridiculous. I'm tired of it. Tell me, I'm coming here and I'm not being admitted to be evaluated. Even the urgent care doctor that I've been going to multiple times, she said there's something going on. They need to fix it.
Well, we'll look at you, and we also have to look at everybody else as well. Okay? I mean, I'm sure that we'll get you fixed up and we'll get you taken care of. But if other people are coming in that are not doing well at the same time, we have to look at those guys as well. Okay?
Right, and your other nurse who he is, he's talking about, oh, it's normal to have your blood pressure high. Okay, no, not that high when I came in. When I came in, it was extremely high. And then he came back in to check on those rolling blood pressure things. It was still high. When it's that high, that's a sign of a stroke or a heart attack. I'm well known to have a heart attack. My uncle died on his way home from work, from working at the Detroit Police Department. He died on his way home, having a heart attack.
What was your blood pressure?
182 over 144.
What was it?
And then the second time it was 160 something over 90. Okay. I'm tired of it. Talking about it's normal. Nope, it's not. I'm tired of being released and going home without transportation. I come here for medical purposes, and then I gotta wait in the waiting room, and then I have to go home. And then 2 days, wherever it was, I had to go home because I got here at 2 o'clock in the afternoon and waited 8 to 9 hours, and then went home because they didn't want to do nothing for me. I think that's how discrimination or something. That's how discrimination or judgment. I mean, we all bleed red. Why don't y'all get about that?
Well, I'm sure the doctor wouldn't clear you if she didn't feel that you were cleared.
No, she didn't see me.
She's a very good doctor.
I'm not talking about tonight. I'm talking about the other time.
Oh, well, I can't speak for that. I'm sorry.
But I ain't sure because she won't see me. She been seeing them.
Did the doctor see you tonight?
No.
You have not seen a doctor?
I ain't seen nobody other than that guy that's been checking my blood pressure. I'm pretty sure it's even more now because I'm tired of it. I got everything on my phone. Well, I got everything on my phone on my Promedica chart to prove that I've been here multiple times, and that every time they draw a lab, it flags high or flag low, and then they tell me, "Oh, go see your PC." Well, I'm putting it in term before y'all think somebody else about it. My primary care physician. Okay, I can't get into my primary care physician in 2 or 3 days because they be booked. I come in from Mercy's. That's why I fly here by EMT. But yeah, y'all talking about, oh, he had history of anxiety and this and that. So you want to judge me based on my past? If that's the case, why you working?
Given a history doesn't mean that they're judging.
Okay, but still, if they wasn't judging me, a doctor would be here right now knowing that I have high blood pressure. I'm also a heart patient. I'm just trying to win the bracelet. But are they coming in for that? Am I hooked up to EKG?
You had a heart attack before?
Here at this new hospital, with my lab result shows. I mean, my EKG shows. My EKG also shows that I have a left ventricle artery blockage. But what did they do? They sent me home. I'm tired of it.
Okay, well, it looks like the doctor's.
No, you can stand with
No,
us.
she looks like, are you available for her? No?
Is she a doctor?
This is
Yeah,
Dr.
Dr.
Calabria.
Calabria. I've seen you before, Mr. Jasper.
Yeah.
Nice to see you again.
Yeah.
You want us to step out then so she can take care of you? If you want to say something afterwards, you can. All right?
Yeah.
Calm down so your blood pressure goes down a little, okay?
Thank you.
Well, Ernest, just the follow up with your PCP. They say just 2 or 3 days. Whenever you can get to them. And we know that they get booked. So it's just because we can only do so many tests here. Your doctor's got to follow up with, you got to follow up with your doctor to do some of the other tests, the further tests. That's the only problem. Because the insurance won't pay for us to do a lot of the tests.
Right.
So you have to, that's why we have you follow up with your family doc. Because they're the ones, especially like with blood pressure, we can get your blood pressure down, but in order to keep it down for medication-wise, sometimes it takes a while to get a blood pressure medicine that is going to suit you. Okay?
Right.
So it's not like an overnight thing to keep it down.
Who is your family doc?
Right now, I'm going through Main Street Urgent Care doctor, Emma,
Okay.
and she's. I wasn't going through the old one before Tecumseh moved to Adrian, which is now known as Main Street Urgent Care. Her name is Emma. She's been prescribing meds for me.
Okay.
And she told me this is ridiculous that you. I know, but I can't afford to go out of state. I have no transportation. You got to stay to get further testing.
I'll let you guys go. I'm sorry.
No, that's okay. No worries.
We can talk to you
Okay.
later if you have some questions.
Okay.
Hi, I'm sorry that you're so upset. Tell me what's going on. I want to help you.
Okay, I've been here multiple times,
Mm-hmm.
and I got proof. I got proof on my phone on my premedical chart. My left ventricle artery is blockage. It's been known that every time I do EKG,
Mm-hmm.
they already pinpoint that I got left artery ventricle blockage, and they still send me home. But yet, they can psychiatrically evaluate me, but they can't.
They say it one more time.
They always want me to be psychologically evaluated, but they can't medically evaluate me by admitting me to get evaluated, like further tests like X-rays, EKG, and all that stuff.
So, unfortunately, the emergency room, we're only able to admit you if you're actively having a heart attack. Do you understand that?
Yeah.
So, if you're not actively having a heart attack, we'll send you home and we'll have you follow up with your doctor and cardiology. The ER only has a certain amount of staff, a certain amount of time. We can't admit everybody. There's only a certain number of beds. So that's why we keep sending you home, because you're not actively having a heart attack.
But I understand that. But this is my point. Whatever the patient come in with, whether it's constipation or whatever, my blood pressure was extremely high when I came in. From paramedics to here and at home, it was high.
Mm-hmm.
And y'all still probably gonna send me home.
Mm-hmm. Well, for blood pressure, if you're not having any symptoms, if you're not having a headache, if you're not having chest pain, if we don't think you're having a stroke, if we don't think you're having a heart attack, we usually will send you home. And again, it's the same thing. Like, we just don't have the capacity. We don't have enough room to help everybody that comes in with high blood pressure. Everybody has high blood pressure almost.
See, that's what he's saying. I'm getting tired of it.
Then you gotta go see a cardiologist, Ernest.
They won't do it without me being without a little slip, whatever.
Without a slip?
Yeah, whatever they call it.
You have to get a referral from your primary doctor.
Right, and I've been getting one, and they have me a heart monitor for a week.
Did they give you a referral and say, go see this cardiologist, go see this heart doctor?
A year or so ago, yeah.
Did you see the doctor?
Yeah, he put me on a heart monitor. Heart vent monitor.
Have you gone back to see him?
No.
Why not? That's who you gotta see.
Cause y'all moved here.
So you can still see the same doctor.
Okay, but I don't have transportation. Cause now I gotta walk home in the dark.
We're an emergency room. We're not a transportation service. That's not our responsibility.
Okay, but you're supposed to supply it.
No, we're not. There's no law that says we're supposed to supply it, Ernest.
Okay, so
If we want to, sometimes we can help people, but that is not our responsibility. Absolutely not. I'm sorry. I'm not trying to be rude to you.
so our taxpayer money is actually going nowhere.
Your taxpaying money?
This taxpayer money is going.
Well, maybe your insurance can help you. Have you called your insurance to see if they can help you get rides? Sometimes they're able to. Like if you have Medicare, a lot of times they can help you get rides.
Yeah, but it'd be too late because.
No. What I'm saying is, they can set up rides for you.
Right, yeah.
Where you call them when you need to go.
Right.
I mean, you can come here, but you can, if you have an appointment with your cardiologist, you can set. Let's say it's in a couple, next week. You call the transportation. You call Medicare, set up the transportation, and they will pick you up and take you to that appointment.
Right.
Yeah. So that's what you need to do. It's not our responsibility as a hospital to get you where you need to go. That is your responsibility. I'm sorry, I'm not trying to be rude, but that is how it works. I have to go to my own appointments. I have to figure out a way to get there. I cannot rely on anyone to take me there. It's part of being an adult.
Yeah, I'm an adult, and y'all basically treat me like trash right now.
No.
Yes, you are, because y'all been sending me home multiple times. That's ridiculous.
We're going through the same argument again, Ernest. I'm sorry, I don't know what to do. What can I do for you right now? Because I've been explaining why we send you home. Because you need to follow up with your cardiologist. We are not responsible for getting you to your cardiologist.
No.
Yeah, so we talk to your insurance, see if you can get that set up. If you need help, we can ask our social worker to help you. I'm happy to do that. But this is not, as a ER, this is not our responsibility. And if you're not actively having a heart attack, we are not going to admit you, and we do not have enough space to see everybody.
So y'all want to send me home with high blood pressure?
Yeah.
That's real unsafe.
Do you know how many people have high blood pressure? Almost everybody, like 50% of the population, Ernest.
Wow, I know that, but still, I'm too young. And last time y'all sent me home, I was hit by a damn car.
All right. Well, you know what? I'm not going to argue with you. If there's something that I can help you with today, I'd be happy to do that. But I can't work miracles. I can't go outside my scope of care. And I'm sorry if you are not finding that acceptable, but that's the way it is. I have to go by those same rules as you do. If my blood pressure is high, I have to get my own self to the cardiologist. If I need help, I call my insurance and I get help. But the ER is not responsible to get you where you need to go for your outside appointments.
I said, yeah, you're bringing it up. I'm not saying nothing about that. What I'm saying, what I'm coming for tonight is get treated.
Okay.
That's what you're not getting. Like this is, I'm going to say it on record. Y'all.
Do you know how to treat high blood pressure?
Yes, I do.
Well, then why don't you treat yourself?
More than y'all. And I haven't went to I completed high school, but I didn't go to college to become a medical professional like y'all did.
Well, if you know everything, then why are you even here?
Because a person's professional in this also needs to be seen. Like you. When something wrong with you, you got to come here to be seen by your colleagues.
Do you know how many people with high blood pressure I send home every day, Ernest?
Because there's nothing high.
Yes, it is. Absolutely, it is.
So you're admitting that y'all send home real high blood pressure?
Absolutely, and that is the standard of care. You can look it up. That is how emergency medicine is practiced. I'm board certified. That is the way we do things. It's not just you, Ernest. We do not have the capacity to help everybody with high blood pressure. If you're not having a heart attack, if you're not having a stroke, then we send you home and you need to follow up. We can give you medications, but you have to follow up. And I can tell you, I send people with high blood pressure home all the time. It's not just you. So I don't want you to feel like you're the one that's being singled out. That's absolutely not what's going on. We are not allowed to do that. We are not allowed to treat one patient differently than the other.
Mm-hmm.
So how can I help you today?
I can't for constipation,
okay.
And your staff just want to sit there and laugh.
Okay, I can help you with constipation. When was the last time you had a bowel movement?
A week or so ago.
A week or so ago. And is that normal for you to go once a week?
Nope.
Okay. Are you having abdominal pain?
Yes.
Are you vomiting at all or having any nausea?
Nausea without vomiting.
Nausea without vomiting. Okay.
I can't eat nothing without getting nauseous. I've been living off of sugar water, sugar milk.
Okay. Can we get some blood work on you? The thing I'm concerned about is, infection or like a bowel obstruction. I want to make sure that that's not what's going on. We may need to do like a X-ray or a CAT scan. Are you okay with us doing that? Okay. Any fevers?
No.
Are you feeling chills?
My tooth. I went to urgent care, which is the same doctor I've seen at urgent care. She felt both of my knees and it's severely cold. It was cold the day I came here first, but they sent me home.
Well, it's not really an emergency to have cold knees.
Okay, but it's also a medical issue. If your body is regular temperature, but your knees is ice cold, that's a sign of a medical issue.
Not necessarily.
Okay, if you look it up in medical WebMD or in dictionary of medical stuff, it'll tell you, it'll pinpoint. You even look up
So if we get labs and we do a workup and everything's okay, that's not an emergency.
Okay, so you're saying everybody else stuff that come here is emergency besides besides people
No, people who have emergencies get admitted. People that don't have emergencies get sent home. That's the way we are an emergency room. So we deal with people who are ready to die, actively dying. I don't think that's ever happened to you.
So y'all basically hospice/angel care.
No.
That's what you just admitted.
We keep people from dying. That's what we do.
So at the old Bixby, I'm not sure if you was there, but a 2-year-old came in from a car accident.
Ernest, I don't want to argue with you anymore. Okay, I'm a board certified emergency medicine doctor. This is the emergency room. We deal with emergencies. There's a very clear-cut delineation of what is an emergency and what is not an emergency. If you are having an emergency, we admit you. If you are not, we send you home. You should be happy you're being sent home because it means you're not dying.
So once again, only like hospice and angel care does.
No. People who are at risk for death, we admit and we take care of the problem. That's not hospice. Hospice is doing no treatment at all and letting people die.
They drug you and let you be comfortable, just the way y'all do.
Nope, we treat people. You can't get treated if you're on hospice. If you're having a heart attack and you're on hospice, you get nothing. If you're having a heart attack and you're not on hospice, you get a cardiac cath, you could get a stent, you could get bypass surgery. There's a lot of different things. That's what we are here for. You understand? If you're not having a true emergency, we will send you home. You're young, you're healthy, you've got high blood pressure, but you're still relatively healthy and you're young. So that's why we send you home, Ernest, because you are too healthy to be in the hospital. All right? Can I listen to your heart?
Yep.
Where is your belly hurting?
All right here.
Okay. All right, I'm gonna, can you stand up for me? I'm gonna order some lab work and an x-ray, okay? Take a deep breath. Deep breath. And deep breath. Are you having any pain when you pee?
I got pure orange urine.
Okay, can you give us a sample of that?
Yeah.
You might be dehydrated. We might need to give you some fluids. All right, I'm gonna order those labs. I'll get you something for nausea, right?
Our system the fuck out here. Is that helping?
You took something? Well, we can give you something. We can try something else. If something doesn't work, we usually try something else. So we can do that. And sometimes medicine you take at home by mouth doesn't work as well as the stuff we give you through the IV. So we can try something by IV. What did you take at home?
I took for constipation to Miralax. For nausea, I took salt, because when you have salt on your tongue or whatever, it stops you from you getting nausea.
Okay.
And then
Can I give you some Zofran through the IV?
Oh, I don't take no drugs.
You don't take any drugs.
I don't take drugs.
It's not a drug. It's a medication.
Right, Zofran is in the steroid.
No, it's not. It's an antiemetic.
Okay, you give me that.
Right. You're challenging, Ernest. You're telling me you're coming to an ER where we prescribe medication, and you're telling me you don't take medication. I don't know what to do for you if you won't let me give you medication. So we'll try Zofran and see if it helps.
This is what y'all doing. I've been here multiple times. Y'all.
I'm not listening to you.
Let me see supervisor. Hey, y'all hear that? That was the doctor for today's shift. She admitted on camera that they only treat patients that has a end of life situation. So they are just like hospice and angel care. Angel care keeps you long as 5 to 6, possible less months, depends on how worse it is. And yes, angel care and hospice care, they do drug you just like these people do. They are a big facility known as hospice care, but they are promoted in Virginia Hospital ER, and she just admitted on camera that she sent patients home with high blood pressure. They do not do anything else. They just send them home with high blood pressure, like they're about to do me. So as y'all heard, I just request for the supervisor again.